How to assess a child with a fever. Our body's temperature needs to stay between 36.5 degrees Celsius to 37.4 degrees Celsius so that our organs and bodily processes work properly. If our bodies get too hot or too cold, it can be very worrying, especially in infants or young children. So, what is too hot or too cold, and when is this a concern? Let's do a quick exercise. Which of these children do you think has a fever and needs further assessment? Grace, who has a temperature of 35.5 degrees Celsius. Salome, who has a temperature of 36.5 degrees Celsius. Ruth, who has a temperature of 37.5 degrees Celsius. Keep in mind that these are their underarm or axillary temperature readings. Did you notice that both Grace and Ruth have a body temperature that is not within the normal range? Grace has hypothermia, which means her body is too cold. Hypothermia is an underarm temperature of 35.5 degrees Celsius and lower. This is a danger sign and will be explained in another video. For a refresher on the danger signs, refer to the job aid on danger signs in another module. Ruth has a fever or hypothermia, which means her body is too hot. According to the World Health Organization, or WHO, a fever is an underarm temperature of 37.5 degrees Celsius or higher. A fever is not an illness itself, but shows that Ruth's body is fighting an illness or infection. It is a sign that Ruth has an illness that may need treatment or closer monitoring. Both viral and bacterial infections, as well as tuberculosis, malaria, and many other illnesses, can cause a fever. As a community health worker, it is important to assess whether the fever is a sign of a mild, moderate, or severe illness. You can then advise the family to care for the child at home if it is a mild illness, or refer them to a health facility if it is a severe illness. If it is a moderate illness, you can decide on the best steps. This video will show you how to assess a child's signs and symptoms if they have a fever. Look out for another video in this module that explains how to act and treat the child based on the findings of this assessment. As you assess a child, start by asking the caregiver questions about the child's symptoms. Number 1. Find out more about the history of the fever. You can ask, when did the fever start, or for how many days has she had a fever? Most fevers go away after a few days. A fever for a longer time may mean that the child has a more severe illness. Is it happening throughout the day and night, only once a day, or occasionally? Does it only happen at night? A fever may be a sign of malaria. If it is, the fever may not be there all the time, or the body may be hotter at different times. Number 2. Consider whether it could be malaria. If the child does not live in a malaria area, you can ask, has the child visited a malaria area recently? A fever in a malaria area or after visiting a malaria area may be a sign of malaria. If you can, do a rapid diagnostic test for malaria, as identifying and treating malaria quickly can save the child's life. Number 3. Ask how active and alert the child is. You can ask, has she been very sleepy, tired, or difficult to wake up? These signs can suggest a very serious illness, and the child will need a referral. Is she able to drink liquids normally? If the child cannot drink enough to stay hydrated, it is a severe sign. Number 4. Find out if the child has other symptoms. You can ask, does she have a blocked or runny nose or sore throat? Symptoms such as these with a fever can indicate a viral infection which may be treated at home. Is she coughing? If the child has a fever and cough with no other symptoms, it's likely a lower respiratory infection like pneumonia. Has she been losing weight or not putting on weight? Is she very tired? Weight loss and being very tired are signs of a more severe illness, such as tuberculosis, HIV, or even cancer. The child should be referred to a health facility for further assessment. Is she vomiting? Does she have a headache? Does she have diarrhea? Vomiting and a headache may indicate meningitis, which is a serious illness. Vomiting and diarrhea are often caused by a gastrointestinal infection, which can become severe if the child cannot drink enough liquids to stay hydrated. A child may have a seizure when they have a fever. This is rare, but if it happens, they should be referred immediately to make sure that the seizure is only a complication of fever and not caused by something more serious like a brain infection. A child with a fever but no other signs may have a urinary tract infection, an infection from an insect bite, or a severe infection like meningitis. Lastly, number 5. Find out if the child has been with anyone who is sick. You can ask, is anyone at home sick? Has anyone been sick lately, and how long were they sick? Is there anyone at home or in the family with tuberculosis or TB or on TB treatment? If the child is in contact with someone who is sick or has TB, they may get infected too. If you know what illness the sick person has, it can help you determine the cause of the child's illness. Asking these questions will help you better understand the child's symptoms and how severe they may be. You will also need to look at the child to gather more information about their signs. Start by taking the child's temperature or feeling the child's forehead. It is best to use a thermometer, but if you don't have one, you can learn to feel the child's forehead to identify a fever. The World Health Organization defines a fever as the child feels hot, the axillary or underarm thermometer reading is 37.5 degrees Celsius or higher, or their rectal or rectum reading is 38 degrees Celsius or higher. Then, look at their nose, throat, skin, and eyes. Look for a blocked or runny nose, a red throat. A common cold can cause these symptoms. A rash with no blisters or itching. Red eyes. Many illnesses can cause rash. Measles usually cause a red and blotchy rash, cough, runny nose, and red eyes. Assess if the child is struggling to breathe. Count the number of breaths per minute in all children with a cough to identify fast breathing. Breathing faster with a cough and fever can indicate bacterial pneumonia. Look for signs such as chest indrawing, widening nostrils when breathing in, blue lips. Listen for sounds such as grunting when breathing out. Any signs of difficulty breathing mean the child is very sick and must be referred urgently. Refer to the videos in the cough module that will show you how to identify difficulty breathing. Lastly, look for signs of meningitis such as a stiff neck. Can the child bend their neck easily as they look around? Draw the child's attention to their toes so that they look down. A child with a fever, headache, and stiff neck may have meningitis and needs urgent treatment. A young child with meningitis may not have a stiff neck. If they have a high or constant fever and are very sleepy, it is a danger sign that requires a referral. You should now have enough information to decide if the fever is a sign of a mild, moderate, or severe illness. If it indicates a mild illness, you can help the caregiver treat the child at home. If it indicates a moderate illness, you will decide whether the symptoms can be treated at home or if the child needs to be referred. However, if it indicates a severe illness, you should refer the child urgently to a health facility. This process will be explained in more detail in another video. Remember, a fever is not an illness, but rather a sign of an illness that may require treatment or closer monitoring. Your role is to find out if the fever is a sign of a mild, moderate, or severe illness so that you can take the correct action.